In the last snippet, I told you all about the early years of American medicine. I told you that it was a one-year course and you would get a degree, which was really disastrous, turning out terrible doctors. But things changed when the Johns Hopkins University was founded in Baltimore. There were four great giants in the faculty there. The first was William Osler, the chairman in the Department of Medicine. Then there was William Welch, the pathologist, a rather bon vivant who loved good life. He was often called Popsy by the students. Then there was Howard Kelly, a very good gynecologist, superb in gynecological surgery. And finally there was William Halsted, the surgeon. Perhaps sometime later, in another snippet, we should talk about it. Today I want to give you an idea of the greatness of a man, physician, called William Osler. When he died in 1999, it was thought, or it was discussed, who was the greatest doctor in the history of the world? And there were many who contended that perhaps it could be Osler. Now, it must be remembered that there has been a great deal of literature, tributes, essays, books, clubs, societies in the name of Osler, which have been carried down to this day. If you ask me, if Osler, besides being a great clinician, was he a great scientist, a great researchist? The answer is no. He couldn't compare, for example, with Harvey, who discovered circulation and changed the face of medicine, or with Pasteur, who postulated that the germ theory of infection was responsible for disease, and that a single germ was responsible for a particular disease, and if you identified that germ, you could make a vaccine and prevent the disease. I don't think he would compare also with Röntgen, who discovered X-rays, which again changed the face of medicine, or with the Curies, who discovered radiation, who changed the treatment of cancer for the first time, or, talking of recent days, of Watson and Crick, who discovered the structure of the DNA molecule. No, he was not a great scientist and a researcher. He was just a great clinician who also researched in clinical medicine and made some inroads into clinical medicine, expanding the frontiers of clinical medicine. He was considered the most famous, the most illustrious, the most lovable, and the most wonderful doctor of his era. If you consider any of his contemporaries in any other field of human endeavor, whether it was science or literature or poetry or whatever have you, you wouldn't possibly be able to prefix all these adjectives to any one single individual in any other field of human endeavor. Would you consider him the greatest clinician ever? That is also a question often asked. It's a difficult question because I don't think you can compare clinicians in different ages. There was Sydenham, for example, who was a great clinician in England. There was Boerhaave of the Netherlands, but you can't compare them. But even if you do compare them, I think Osler would rank somewhere at the top. During his time, the British thought that Sir Clifford Albert had the clinical acumen which was as good as that of William Osler. But he didn't have the literary flourish, he didn't have the philosophy, He didn't write as much on education as Osler did. And what is more, his foray in clinical medicine was by and large localized to cardiovascular medicine, whereas Osler had a large breadth of vision with regard to clinical medicine. I will give you a brief outline first of the milestones in his life. His parents had a Celtic origin, originally from Cornwall, and emigrated to the most northern part of Canada in a God-forsaken frontier of the Canadian territory. They were Protestants. And he was born on the anniversary of the Battle of Boyne. The Battle of Boyne was a battle between William of Orange and James V of England. And it was a victory for William of Orange, a Protestant cause, and they were Protestants. And every year, every anniversary was celebrated, even in that small hamlet. So after he was born, his father quickly took him to this celebration because he was born in that anniversary. And they were all celebrating, and he held forth his little infant, and they all cried, "Call him William, William from William of Orange." And that's why he was called William Osler. He was a naughty student, expelled from school at one time. To cut this short, he joined in Montreal the great McGill University and became a doctor. There he started a physiology lab. There he looked after smallpox patients which nobody wanted to look after. There he did autopsies to see what happened to his patients he was looking after. He became a professor in medicine at the young age of 27 or 29. Then he went on to become professor in the University of Pennsylvania at Baltimore. At the age of 33, he was called the baby professor. And when he was under 40, at the age of 38, he was invited to become the chairman of the medical faculty at Johns Hopkins Hospital. And there he trained numerous students who fanned out not only in the United States, but all over the world, carrying the imprint of his great teachings. Now let me tell you what happened after that. He remained in Johns Hopkins for the greater part of his life. And then when he was 53, he was invited to become Regius Professor of Medicine at the University of Oxford. He wasn't keen to go, but his wife said, "No, you must go. You're tired, you're overworked, you're so stressed with everything. Do you want to leave this world now in a coffin, or do you want to go in a steamer to England?" So he smiled and said, "Well, we'll go in a steamer to England." He was very popular there also. And it was in Oxford that he died. He died of bronchopneumonia, empyema. It was 1919, believe me. Remember the flu season, the flu epidemic, the great influenza epidemic, the Spanish flu. It is possible that it was the Spanish flu that first caught him. And as a complication, he developed bronchopneumonia, empyema, and died. His remains, as that of his wife, are in an urn in the University of Montreal. He had bequeathed his whole library to the University of Montreal, McGill University, and he said he would be very happy. It was beautifully housed, so that perhaps if his astral body visited it, he would be pleased to see his old books and people enjoying it. Now let me tell you about his great qualities. Let me tell you about his writings. He had more than 1,600 writings in medicine, in philosophy, on medical education, on medical history. His greatest writing was a single-authored textbook on the principles and practice of medicine. He wrote this when he was at Hopkins Hospital. It went into several editions, was translated into almost all languages, including Chinese, including Russian, and several other languages. It was a milestone in the literary aspect of textbooks, as far as textbooks in medicine go. That was not enough. He described, as I told you, a number of new clinical entities. He described hereditary hemorrhagic ataxia, also called the Osler-Weber-Rendu disease, a condition where you have capillary telangiectasia, where you can bleed from mucous membranes anywhere in the body. He described, together with Libman, subacute bacterial endocarditis. He described verrucous endocarditis of systemic lupus erythematosus. He described the Osler-Walker disease, which is polycythemia vera, the Osler's phenomenon, which is the agglutination of platelets. And he described, of course, the Osler nodes in subacute bacterial endocarditis and the Osler syndrome of a mobile stone in the common bile duct, which could give rise to attacks of fever and jaundice. These were his medical writings. But he had also great writings outside the medical literature. And the greatest of them were a book titled My Way of Life, and essays titled Equanimitas, and other essays in the form of addresses to medical students, to nurses, and to practitioners of medicine. Indeed, they are a great literary fleet. He had a superb pen, which I think would put aside many accomplished authors as far as literature was concerned. And in his writings, he spoke of his three ideals, which I think I must speak to you about. This is what he said. Do your day's work as best as you can and forget the morrow. His second ideal, act the golden rule as best as you can with your professional brethren and for patients under your care. And the final one, which was indeed beautiful, cultivate to a great measure equanimity, which will enable you to bear success with humility, the friendship of your friends with pride, and teach you to reach out or prepare for the day of sorrow and grief, so that you meet it with the courage befitting a man. And this indeed did happen to him. The greatest blow that he suffered was the loss of his only son, called Revere, in the First World War in 1918, the horrible carnage in the Battle of the Somme. Would you believe it? He had a head injury. He was taken promptly. He was recognized as Osler's son. He was taken promptly to the base camp as fast as you can. Would you believe it that at the base camp, the doctor was Harvey Cushing, the great neurosurgeon, also trained at Johns Hopkins, friend of Osler, friend of Alston, the surgeon there. He tried his best, but the boy died. He was, of course, heartbroken, a blow from which I think he'd never really recovered. So that's as far as his writings go. What about his teachings? What about his education? Right from the start, ever since he was a professor at McGill University as a professor of medicine, he taught bedside medicine rather than didactic lectures. He believed that medicine was to be taught at the bedside. Medicine was to be learnt at the bedside. I shall quote his actual words. Learn to use your eyes, your ears, your hands, your sense of touch and your sense of smell, and know that only with practice can you become perfect. Do not let the conceptions of disease be based on what you hear in a lecture room or even what you read in a book. See first. then discuss, then decide, but see first. This is what he said, and this is how he stressed the importance of bedside medicine as far as the teaching of medicine went. It's a shame, if I may digress today, to realize that there is hardly any bedside medicine today. You see doctors relying more on instruments, machines, and gadgets, rather than being at the side of the patient. But no machine or gadget can take a proper history, which is a dead art today. No machine or gadget can perform a proper physical examination, which is also a dead art and science today. It is not realized very often by medical students, by registrars and doctors, that mere observation with your senses can discover things in a patient which no machine can detect. I'm talking to my boys and girls at the British County Hospital now. No machine, for example, can detect a pleural rub, or a pericardial rub, or bronchial bleeding, or detect the slight droop of the eye in a partial third nerve palsy, or an asymmetry of the face in a partial seventh nerve palsy. No machine can detect a myasthenic face in the early phase, a myopathic face, or the face, typical face of myotonia dystrophica. No machine can detect a gynecomastia in a patient with liver cell injury or liver cell disease, or the spider nevus, a characteristic of liver cell disease. I very well remember, many years ago, a patient with severe abdominal pain, unremitting abdominal pain, stopping, coming back again for days, stopping. He was discussed by the GI people, turned upside down by the GI people. He also had retention of urine. They said it was an enlarged prostate. But they only looked at the GI system. Had they examined him well, they would have noted that he had absent reflexes and the ankle jerks were absent. The pupils were not quite normal. Also, there was a soft murmur, diastolic murmur of aortic incompetence. There was no 2D echo in those days. The diagnosis was scabies, which was missed all the time, and the patient's, the doctor's attention being concentrated only on the abdomen. So you can have, through observation, make remarkable observations that will tell you the nature of the disease, which perhaps no machine could detect. I think it's so important to remember that. And now you have even more. You have robotic medicine. You might have a robo in times to come who will feel your pulse and tell you what it is, who will hold your hand and say you're going to get well. Would you like that? And then you have also intelligence, artificial intelligence. Of course it's useful. Of course it will give you more information. But it all depends upon the information you feed to the machine that is going to be artificially intelligent. And isn't it possible that you might be so lazy that any problem that comes in medicine you'll give to the machine that gives you the answer? Wouldn't that atrophy your brain in time to come? So these are some of the dangers of medicine to come, some of the dangers of the future of medicine. Well, I've talked to you about his educational and his teaching abilities. I've talked to you about what he thought were his ideals when he wrote about so many things in relation to medicine and otherwise. I shall now talk about a few other things. Osler was a bibliophile. He had 14,000 volumes of books. And I told you he donated them to the McGill University, where they still are today. Also, he was a great ethicist. Ethics ruled his practice, not only in medicine, but in life. And I remember well his quote from his very favorite book, Medicne by Thomas Brown. He quotes here, "Do not enter the temple of science with the soul of a moneylender." Then let me come to one of his greatest qualities, his humanism. What is humanity or humanism? Frankly, a very simple definition would be the attribute or the ability or the quality rather that enables the physician to be able to appreciate, feel and understand the suffering and pain of a patient, and the quality of that physician to be able to try his best to relieve it. Humanity includes not sympathy but caring, and it includes empathy. They are almost synonymous. Humanity, empathy and caring are almost synonymous. I have never known or come across a patient, or rather a doctor, with true humanity and true caring, who's also clean and ethical. I've not come across one. There might be exceptions. But it's interesting how important caring, empathy in medicine really is. Osler, at that time and in that area, humanity was not a common thing. Physicians, particularly the well-to-do physicians, were dressed in top hats with gold-knobbed sticks and with gold-chained watches tucked into their vests. They treated very often their patients as objects rather than human beings. But Osler's innate philosophy in life, his innate philosophy in his professional activities to patients and to all else, was based on humanity and humanism. I'd like to give one or two of his quotes in this respect. The first, take more care of the patient rather than pay attention to the peculiarities of his disease. The second, the practice of medicine is an art and not a business, a calling and not a trade, a calling which equally exercises your heart as the head. So this is what he thought medicine was. And this was his expression as far as humanity went. I need to give you two examples of his humanity. He comes across in the deep winter, when it's snowing hard, a patient whom he knew was an alcoholic, very poorly clothed. So he takes off his coat, puts it on the man's shoulder and says, "Here, please take this coat. I have a father as old as you. I know you will continue to drink. Perhaps you will drink yourself to death. But I cannot allow you to freeze in the cold." And then another beautiful example. In Oxford, when he was going to a convocation ceremony, one of his colleagues appealed to him to see his very, very sick son. So in his convocation gown, he sees this little boy, 7 years old or 8 years old, skin and bone, almost dying. What did he have? He had severe whooping cough, was coughing all the time. What is worse, he refused to eat. No blandishments from the father, who was the doctor, the mother, the nurse. He had a brother from the brother. No blandishments would enable him to eat. Also sat by his side, talked to him, made him feel his walrusy moustache, a huge walrus moustache, played with him. And then in front of him, He peels a pear, sugars it himself, takes a bit of it, talks to the boy and says, "Come on, you will eat this." And bit by bit, he feeds him the whole pear. As he goes out, he tells the father, "I don't think this boy will recover. He's coming to the end. I'm so sorry." But he sees him every single day for 40 days, feeding a little nourishment, more and more every day. His prognosis was wrong. To his surprise, to everyone's surprise, the boy recovers. What is this? This is an exemplary example of the healing art of medicine. What was it that did it? His personality, the change in the environment, maybe the dress that he was wearing, maybe the way he talked, maybe his gentleness, maybe his kindness. But this is an example again that medicine is not just treating the disease, it is also the art of healing. So these are two examples of his humanity. I think I've more or less covered all his facets. I need to conclude. He was, of course, a great clinician. He made inroads and expanded the frontiers of clinical medicine. He was not a great scientist or a great researcher, as I told you. But he will be known to posterity not just for his wisdom, his literature, his literary heritage that he has left behind, books not related to medicine but to philosophy, his advice to students, but above all for humanity, for his humanism. That is what he will be mainly known for. So, my dear boys and girls, I have given you the example of a great man. His greatest favorite book, remarkably, was by Sir Thomas Browne, Religio Medici. And he's quoted extensively from that book. I stumbled upon that book when I was in deep emotional turmoil. And I read a good bit of it. There's no real medicine in it. It is just a description of what a good life should be. And a good physician can never be a good physician unless he has a good life. Austin doesn't quote this, but I'm going to try and quote something which I memorized many years ago. Bless me, O Lord, with the peace of my conscience, the love of thyself, and the affection of my dearest friends, and I shall be happy enough to pity Caesar. These are the humble desires of my most reasonable ambitions, all that are all happiness in this earth. Dispose of me as thou wilt according to the wisdom of your pleasure. Thy shall be done, though in my own undoing. Thank you, ladies and gentlemen.